Recently on Face the State, you were quoted as stating that there are no solutions that involve more government. There are only solutions that involve the free market. Several months ago, you proposed taxing health care benefits with an offsetting personal tax deduction to bring down the cost of health care. Do you believe that's a free market solution?
Well, what I'm trying to do is trying to get the health insurance decisions to not be impacted by the tax code and to be made by individuals and not employers. The way it works right now, employees have a choice. I can pay you, let's say, $10,000 in cash, or, I can give you $5,000 in cash, or you can have $10,000 worth of health care benefits. Because if employers pay you in cash, you have to pay taxes on the money. But if they give you the health benefits, that's tax-free. That means the employer has a government-created incentives to favor getting insurance over money. I think that's distorting the economy, and it's causing the overutilization of health insurance, and it's causing people to treat health insurance as if it's there to pay for ordinary medical expenses. So what I want to do is end that distortion one way or another. So you can do it a number of ways. One way would simply be to allow the employer to give you that $10,000 tax-free. And so you can either have $10,000 worth of cash or the $10,000 health insurance policy. But I think if individuals have that choice, they might take the cash, buy a major medical policy that might only cost $2,500 a year, and put the rest in their pocket. But then, when individuals are cost-conscious, when they get sick or they want to go to the doctor, they might check around. They might try who's the least expensive. If the doctor says, well, you should have this test, they might ask, well, is it really necessary? How much does it cost? We have to bring market forces back into the medical profession. Right now, it's not there. But if you look at the areas of medicine where the government's not involved, you look at eye LASIK surgery, prices are coming down every year, and the quality is going up. Braces are a lot less expensive than they used to be. Insurance doesn't cover it. People pay for that on their own. So we have to bring back market forces back into healthcare. The way the government has it now, the way the tax system is set up, we're preventing the market from functioning. And that's one of the reasons, it's not the only reason, but it's one of the reasons that healthcare costs are going up instead of down, which is what they should be doing in a free market. Then you've got other ways the government screws it up by not allowing insurance companies to compete with one another over state lines, or international insurance companies to compete with domestic insurance companies. And you have this crazy legal system that we have where the punitive damages are so high based on the jury awards that you force the doctors to do all sorts of tests that they know are unnecessary, but they simply do them because the insurance companies want them to do it. And of course, the awards being so high, malpractice insurance is prohibitively high. It's so expensive that many doctors can't even afford to practice because of the expense of the malpractice insurance. So we need to bring in these market-based reforms that will bring down healthcare costs and allow quality to continue to rise.